Question 1. To address the challenge of monitoring a canine patient with multifocal splenic masses undergoing novel chemotherapy, which imaging approach best facilitates an objective assessment of therapeutic response according to established veterinary radiological principles? Option A. Performing serial abdominal ultrasound examinations at regular intervals, measuring the largest diameter of each identified splenic mass and comparing these measurements to baseline, while also noting any new lesions or changes in echogenicity. Option B. Conducting a single follow-up abdominal ultrasound examination at the end of the planned treatment course, focusing only on the most prominent splenic mass identified at the initial examination. Option C. Relying on the treating veterinarian's clinical impression of the patient's overall well-being and appetite as the primary indicator of treatment efficacy, with imaging used only if significant clinical deterioration occurs. Option D. Utilizing thoracic and abdominal radiographs every 2 weeks to assess for any gross changes in organ size or the appearance of new masses, without specific measurements of existing lesions. The correct answer is A. Performing serial abdominal ultrasound examinations at regular intervals, measuring the largest diameter of each identified splenic mass and comparing these measurements to baseline, while also noting any new lesions or changes in echogenicity. Explanation. The scenario presents a common challenge in veterinary radiology, accurately assessing therapeutic response in a patient with a complex multifocal disease. The difficulty lies in distinguishing true treatment efficacy from natural disease fluctuation, artifact, or progression in unaffected areas. This requires a nuanced understanding of the disease process, the imaging modality's limitations, and the specific therapeutic intervention. Careful judgment is paramount to avoid premature discontinuation or unnecessary continuation of therapy, both of which have significant implications for patient welfare and resource allocation. The correct approach represents best professional practice by adhering to established guidelines for monitoring treatment response in veterinary oncology and radiology. This involves a systematic, objective evaluation of serial imaging studies against a defined baseline, considering established criteria for response assessment, e.g., RECIST-like principles adapted for veterinary medicine, though not explicitly named in regulations. The underlying principles of standardized measurement and comparison are implicitly expected. This methodical approach ensures that decisions are evidence-based and reproducible, aligning with the ethical obligation to provide optimal patient care and the implicit expectation of professional diligence within the DACVR framework. An incorrect approach that relies solely on subjective interpretation without objective measurements fails to meet professional standards. This can lead to misinterpretation of findings, potentially resulting in inappropriate treatment adjustments. Such a failure could be considered a breach of professional responsibility, as it deviates from the expected rigor in diagnostic interpretation and patient management. Another incorrect approach, such as focusing on a single lesion without considering the overall disease burden, ignores the multifocal nature of many conditions and can lead to an incomplete or misleading assessment of therapeutic efficacy. This demonstrates a lack of comprehensive evaluation, which is a cornerstone of responsible veterinary practice. Professionals should employ a decision-making framework that prioritizes objective data collection, standardized assessment protocols, and correlation with clinical signs. This involves establishing clear imaging endpoints for response assessment prior to initiating therapy, performing serial imaging at appropriate intervals, and utilizing quantitative or semi-quantitative methods where possible. When subjective assessment is necessary, it should be performed by experienced radiologists and clearly documented, with an acknowledgement of potential limitations. Correlation with the treating veterinarian's clinical assessment is also crucial for a holistic evaluation of patient progress. Question 2. The monitoring system demonstrates that a small avian patient is exhibiting signs of respiratory distress, making standard lateral recumbency positioning for thoracic radiography challenging without causing further compromise. The veterinarian must obtain a diagnostic thoracic radiograph to assess for potential pneumonia or other cardiopulmonary abnormalities. Option A. Attempt to force the bird into a standard lateral recumbency, using firm restraint to achieve the desired position, as this is the standard for most thoracic radiographs. Option B. Gently position the bird in a modified dorsal recumbency, supporting the sternum and ensuring the keel is not compressed, while minimizing handling and using a small, padded trough to maintain a true lateral projection of the thorax. Option C. Proceed with the radiograph in whatever position the bird can tolerate without further manipulation, accepting a potentially oblique or poorly defined image. Option D. Administer a higher dose of sedative than initially planned to ensure the bird remains immobile in a standard lateral position, overriding concerns about potential respiratory depression. Correct answer is B. Gently position the bird in a modified dorsal recumbency, supporting the sternum and ensuring the keel is not compressed, while minimizing handling and using a small, padded trough to maintain a true lateral projection of the thorax. Explanation. This scenario presents a professional challenge rooted in the ethical imperative to provide the highest standard of care while adhering to the principles of responsible radiation use and patient welfare, as guided by the American College of Veterinary Radiology, DACVR ethical guidelines, and the principles of veterinary radiology. The core dilemma lies in balancing the need for diagnostic imaging with the potential for patient discomfort or injury due to suboptimal positioning, especially in a species with unique anatomical considerations. The veterinarian must make a judgment call that prioritizes diagnostic accuracy and patient safety, even when faced with limitations. The correct approach represents best professional practice because it prioritizes patient well-being and diagnostic efficacy through meticulous attention to species-specific anatomy and positioning techniques. This aligns with the DACVR emphasis on the responsible application of diagnostic imaging, ensuring that procedures are performed in a manner that minimizes risk and maximizes diagnostic yield. By employing a technique that accounts for the delicate nature of the avian respiratory system and the need for precise alignment, the veterinarian upholds the ethical obligation to avoid unnecessary harm and to achieve a diagnostically useful image. This approach reflects a deep understanding of comparative veterinary radiology and a commitment to patient-centered care. An incorrect approach that involves forcing the bird into a standard mammalian lateral recumbency without appropriate padding or support would be professionally unacceptable. This failure would violate the ethical principle of minimizing patient suffering and could lead to iatrogenic injury, such as fractures or respiratory compromise, due to the bird's fragile skeletal structure and unique physiology. Furthermore, such a poorly positioned image would likely be diagnostically inadequate, failing to meet the standards of professional radiology and potentially leading to misdiagnosis or delayed treatment. Another incorrect approach, such as proceeding with a poorly positioned image without attempting to correct it, would represent a failure to uphold professional standards. This would disregard the fundamental principles of diagnostic imaging, where image quality is paramount for accurate interpretation. Ethically, it would be a dereliction of duty to submit a suboptimal image that could lead to misinterpretation and harm to the patient. Finally, an approach that involves sedating the bird excessively to achieve a specific position, without considering the risks associated with avian anesthesia and the potential for respiratory depression, would also be ethically problematic. While sedation might facilitate positioning, it introduces additional risks that must be carefully weighed against the benefits. The decision to sedate should be based on a thorough risk-benefit analysis and performed by a veterinarian experienced in avian anesthesia, ensuring that the patient's safety remains the primary concern. Professional decision-making in such situations requires a systematic approach. First, thoroughly assess the patient's condition and species-specific needs. Second, consult relevant literature or experienced colleagues regarding appropriate positioning techniques. Third, carefully consider the risks and benefits of different approaches, including sedation. Fourth, prioritize patient safety and welfare above all else. And fifth, strive to obtain the highest quality diagnostic image possible within these constraints. Question 3. The performance metrics show a slight increase in the incidence of adverse reactions to iodinated contrast media in the radiology department over the past quarter. What is the most appropriate immediate course of action for the veterinary radiologists? Option A. Initiate a thorough review of the contrast media administration protocols, patient selection criteria, and post-procedure monitoring for all contrast-enhanced radiographic examinations, and consult with internal or external experts if necessary to identify contributing factors and implement corrective measures. Option B. Focus on the financial implications of the increased adverse reactions and explore options for reducing the cost of contrast media to offset potential expenses. Option C. Continue current contrast media administration practices, assuming the increase is within acceptable statistical variation and does not warrant immediate intervention. Option D. Immediately discontinue the use of all iodinated contrast media for all radiographic procedures until the cause of the increased reactions can be definitively identified and resolved. The correct answer is A. Initiate a thorough review of the contrast media administration protocols, patient selection criteria, and post-procedure monitoring for all contrast-enhanced radiographic examinations, and consult with internal or external experts if necessary to identify contributing factors and implement corrective measures. Explanation: the performance metrics show a slight increase in the incidence of adverse reactions to iodinated contrast media in the radiology department over the past quarter. This scenario is professionally challenging because it requires balancing the diagnostic benefits of contrast-enhanced radiography against the potential risks to patient safety. Radiologists have an ethical and professional obligation to minimize harm while maximizing diagnostic accuracy. Decisions regarding contrast media use must be guided by current scientific evidence, institutional protocols, and a thorough understanding of patient-specific risk factors. The correct approach represents best professional practice because it prioritizes patient safety through a comprehensive risk-benefit assessment and adherence to established guidelines. This involves a proactive review of the performance metrics, consultation with colleagues and specialists, and a commitment to updating protocols based on emerging data. Such an approach aligns with the core principles of veterinary medical ethics, emphasizing beneficence and non-maleficence, and reflects the professional responsibility to maintain high standards of care as expected by the DACVR. It also implicitly acknowledges the importance of continuous quality improvement within the practice. An incorrect approach that involves continuing current practices without investigation fails to address a potential safety issue, thereby violating the principle of non-maleficence. This inaction could lead to preventable patient harm and a breach of professional responsibility. Another incorrect approach, such as discontinuing all contrast media use, is overly broad and ignores the significant diagnostic advantages contrast media offer in many cases. This would be a failure of beneficence, as it would deny patients potentially life-saving diagnostic information. A third incorrect approach, focusing solely on the cost implications of adverse reaction without a thorough clinical investigation, prioritizes financial concerns over patient well-being, which is ethically unacceptable and contrary to professional standards. Professionals should approach such situations by first acknowledging the data, then initiating a systematic investigation to understand the root cause of the increased adverse events. This involves reviewing individual cases, assessing the contrast agents used, the administration protocols, and the patient populations. Collaboration with internal teams and potentially external experts is crucial. The decision-making process should involve a thorough risk-benefit analysis for each contrast-enhanced procedure, considering patient history, comorbidities, and the availability of alternative diagnostic methods. Ultimately, decisions should be evidence-based, patient-centered, and aligned with the highest ethical and professional standards of veterinary radiology. Question 4. Strategic planning requires a radiologist to accurately identify specific anatomical landmarks on diagnostic imaging studies to ensure precise localization of findings and guide subsequent diagnostic or therapeutic interventions. Consider a scenario where a radiologist is evaluating a thoracic radiograph of a canine patient. Which of the following approaches best demonstrates the systematic and accurate identification of anatomical landmarks, adhering to the principles of diagnostic radiology expected for DACVR certification? Option A. Focusing primarily on the presence of any obvious pathology, such as masses or consolidation, and only briefly glancing at the vertebral column and ribs for general orientation. Option B. Assuming the typical location of the diaphragm based on the patient's age and breed, without explicitly identifying the costophrenic angles or the crura. Option C. Confirming the position of the carina and the bifurcation of the trachea into the mainstem bronchi, and then verifying the dorsal spinous processes of the thoracic vertebrae align with the ventral aspect of the ribs at the level of the scapula. Option D. Relying on the general shape of the cardiac silhouette and the overall lung field pattern to infer the location of key anatomical structures. The correct answer is C. confirming the position of the carina and the bifurcation of the trachea into the mainstem bronchi, and then verifying the dorsal spinous processes of the thoracic vertebrae align with the ventral aspect of the ribs at the level of the scapula. Explanation: strategic planning in veterinary radiology, particularly for board certification, necessitates a thorough understanding of anatomical landmarks for accurate image interpretation and procedural guidance. This scenario presents a challenge because subtle variations in anatomical positioning or the presence of artifacts can obscure or mimic critical landmarks, leading to misinterpretation. The ability to consistently and accurately identify these landmarks is fundamental to diagnostic radiology and directly impacts patient care and diagnostic confidence. The correct approach represents best professional practice because it demonstrates a systematic and evidence-based method for landmark identification, prioritizing accuracy and reproducibility. This aligns with the core principles of diagnostic imaging and the rigorous standards expected of a diplomate of the American College of Veterinary Radiology, DACVR. Adherence to established anatomical references and a critical evaluation of image quality are paramount for ensuring diagnostic integrity and patient safety, which are implicitly regulated by the DACVR commitment to maintaining high standards of veterinary radiological practice. An incorrect approach that relies solely on subjective visual cues without corroborating anatomical knowledge is professionally unacceptable. This could lead to misidentification of structures, resulting in inaccurate diagnoses or inappropriate treatment recommendations. Such a failure would contravene the ethical obligation to provide competent and accurate diagnostic services, a cornerstone of professional conduct expected by the DACVR. Another incorrect approach that prioritizes speed over accuracy by making assumptions about landmark location based on common presentations is also professionally deficient. This haste can lead to overlooking subtle but significant anatomical variations or pathological changes, thereby compromising diagnostic quality. This disregard for meticulous examination violates the principle of due diligence inherent in professional practice and the DACVR mandate for excellence. A further incorrect approach that dismisses the importance of specific anatomical landmarks in favor of a general overview of the region is equally problematic. This demonstrates a lack of foundational knowledge and an inability to perform a detailed, systematic radiological assessment. Such an approach would fail to meet the diagnostic rigor expected of a DACVR diplomate, potentially leading to misdiagnoses and suboptimal patient outcomes. The professional decision-making process for similar situations should involve a systematic review of the imaging study, starting with an assessment of image quality and the presence of any artifacts. Next, the radiologist should actively seek out and confirm the identification of key anatomical landmarks relevant to the region of interest, referencing anatomical atlases or established protocols when necessary. Any discrepancies or ambiguities should prompt further investigation, including obtaining additional views or consulting with colleagues. This methodical approach ensures that interpretations are based on sound anatomical understanding and are reproducible, thereby upholding the highest standards of diagnostic radiology. Question 5. Consider a scenario where a referring veterinarian requests a specific, unusually high kilovoltage (kVp) setting for a thoracic radiograph of a small feline patient, stating a desire for maximum penetration to see through all tissues. As a diplomate of the American College of Veterinary Radiology, DACVR, how should you best approach this request to ensure optimal diagnostic outcome and patient safety, adhering strictly to U.S. regulatory frameworks and ACVR guidelines? Option A. Proceed with the requested high kVp setting without modification, assuming the veterinarian's intent is to achieve a specific diagnostic visualization, even if it deviates from standard protocols. Option B. Decline to use the requested high kVp setting and insist on using a standard thoracic exposure technique for felines. Without further explanation to the referring veterinarian. Option C. Evaluate the requested kVp in conjunction with appropriate milliamperage second (m) as to achieve adequate penetration for the feline thorax while minimizing scatter radiation and ensuring diagnostic image quality, and communicate any necessary adjustments and the rationale to the referring veterinarian. Option D. Increase both the kVp and m as significantly beyond standard recommendations to ensure maximum penetration as requested, prioritizing the veterinarian's explicit instruction over potential radiation dose concerns. The correct answer is C. Evaluate the requested kVp in conjunction with appropriate milliamperage second, m, as to achieve adequate penetration for the feline thorax while minimizing scatter radiation and ensuring diagnostic image quality, and communicate any necessary adjustments and the rationale to the referring veterinarian. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary radiology where the radiologist must balance the need for diagnostic image quality with the ethical and regulatory imperative to minimize radiation exposure to the patient. The veterinarian's request for a specific exposure technique, while potentially well-intentioned, may not align with optimal radiographic principles or current best practices for radiation safety, as dictated by the American College of Veterinary Radiology, DACVR, guidelines and relevant U.S. federal and state regulations concerning radiation use in veterinary medicine. The challenge lies in interpreting the request, evaluating its technical feasibility and safety, and communicating a reasoned professional recommendation that prioritizes patient well-being and diagnostic efficacy within regulatory bounds. Correct approach analysis. The correct approach involves a thorough evaluation of the requested exposure parameters in the context of the specific patient, the anatomical region of interest, and the diagnostic goals. This includes considering factors such as patient size, tissue density, and the limitations of the imaging equipment. The radiologist must then apply fundamental principles of radiographic exposure, such as the concept of achieving adequate penetration of the anatomical structure while minimizing scatter radiation and dose creep. This involves selecting appropriate kilovoltage, kVp, and milliamperage second, m, as settings to achieve the desired contrast and density. Critically, this approach necessitates a professional judgment call based on established radiographic principles and an understanding of the ALARA, as low as reasonably achievable principle, which is a cornerstone of radiation safety regulations in the United States. The radiologist's responsibility is to ensure that the exposure technique chosen will yield diagnostic quality images without unnecessary radiation dose, adhering to both the spirit and letter of veterinary radiology regulations. Incorrect approaches analysis. One incorrect approach would be to blindly follow the veterinarian's requested exposure technique without critical evaluation. This fails to uphold the radiologist's professional responsibility to ensure diagnostic quality and patient safety. It could lead to underexposed or overexposed images, requiring repeat exposures and thus increasing radiation dose unnecessarily, which violates the ALARA principle and potentially state radiation control regulations. Another incorrect approach would be to dismiss the veterinarian's request outright without providing a reasoned alternative or explanation. This demonstrates poor communication and a lack of collaborative practice, which is essential in a veterinary team. While the radiologist has the expertise to determine optimal exposure, failing to explain the rationale behind any deviation from the request can lead to misunderstandings and erode trust. This approach does not align with the ethical obligation to provide clear and informed professional advice. A third incorrect approach would be to prioritize achieving a specific image appearance, e.g., extreme contrast, at the expense of radiation safety, even if the requested parameters are technically achievable. This would represent a failure to adhere to the ALARA principle and could result in a patient receiving a radiation dose that is not reasonably achievable for diagnostic purposes, potentially violating federal and state radiation safety standards. Professional reasoning. Professionals in veterinary radiology must adopt a decision-making process that integrates scientific knowledge, ethical considerations, and regulatory compliance. And presented with a request that may deviate from optimal practice, the process should involve 1. Understanding the request and the underlying intent. 2. Evaluating the request against established principles of radiographic exposure and patient safety. 3. Considering the specific patient and diagnostic objectives. 4. Applying the ALARA principle. 5. Formulating a professional recommendation based on this evaluation, which may involve accepting, modifying, or rejecting the initial request with clear justification. 6. Communicating this recommendation effectively to the referring veterinarian, fostering a collaborative approach to patient care. This systematic approach ensures that diagnostic efficacy and patient welfare are paramount, while adhering to all relevant regulations. Question 6. The investigation demonstrates a complex vascular anomaly in a canine patient, requiring detailed anatomical and functional assessment. The radiologist has generated multiplanar reformations, MPR, and volume-rendered images, VRT, from a CT angiography dataset. Which of the following approaches best represents the highest standard of diagnostic interpretation and professional practice for a DACVR diplomate in this scenario? Option A. Performing a comprehensive analysis of the axial source images, MPR and VRT, correlating the vascular anatomy and blood flow dynamics to definitively characterize the anomaly and its potential sequelae. Option B. Prioritizing the generation of the most visually striking 3D reconstructions for presentation, with a secondary review of the axial source images. Option C. Relying primarily on the VRT to describe the overall vascular architecture, assuming the axial images are sufficient for detailed assessment. Option D. Focusing the interpretation on the angiographic phase that shows the greatest ossification of the target vessels, without a thorough review of other phases or reconstructions. Correct answer is B. Prioritizing the generation of the most visually striking 3D reconstructions for presentation, with a secondary review of the axial source images. Explanation. The investigation demonstrates a scenario where advanced CT techniques are employed to diagnose a complex vascular anomaly in a canine patient. The situation is professionally challenging due to the need to balance diagnostic efficacy with patient safety and the responsible use of advanced imaging modalities. The radiologist must not only accurately interpret the complex 3D reconstructions and angiographic data, but also ensure that the acquisition parameters and post-processing methods adhere to established veterinary radiology standards and guidelines, particularly those relevant to the Diplomate. American College of Veterinary Radiology, DACVR certification. The ethical imperative is to provide the highest quality diagnostic information while minimizing radiation exposure and contrast media risks to the patient. The correct approach represents best professional practice because it prioritizes a comprehensive and accurate interpretation of the advanced CT data, directly addressing the diagnostic question posed by the referring veterinarian. This involves meticulous review of the 3D reconstructions to understand the spatial relationships of the vascular anomaly and the detailed analysis of the angiographic sequences to assess blood flow dynamics and identify potential complications. Adherence to established protocols for contrast administration, radiation dose optimization, and image post-processing ensures that the diagnostic information is reliable and obtained in a manner that is consistent with current best practices in veterinary diagnostic imaging, as expected of a DACVR diplomate. This approach aligns with the core principles of responsible veterinary practice, emphasizing patient welfare and diagnostic accuracy. An incorrect approach that focuses solely on generating aesthetically pleasing 3D reconstructions without a thorough analysis of the underlying angiographic data would be professionally unacceptable. This fails to provide the necessary functional information about the vascular anomaly, potentially leading to an incomplete or inaccurate diagnosis. Ethically, this represents a failure to meet the diagnostic needs of the referring veterinarian and compromises patient care. Another incorrect approach, such as using suboptimal contrast agent volumes or injection rates without justification, could lead to poor image quality, rendering the advanced techniques less effective and potentially increasing the risk of adverse reactions without a commensurate diagnostic benefit. This would violate the principle of prudent use of diagnostic agents and could be seen as a deviation from established best practices for contrast-enhanced CT. Furthermore, an approach that disregards radiation dose optimization, leading to unnecessarily high exposure, will be ethically and professionally unsound, failing to uphold the ALARA, as low as reasonably achievable principle. Professional decision-making in such situations requires a systematic approach. First, clearly define the diagnostic question. Second, select the most appropriate advanced CT technique, e.g., 3D reconstruction CT angiography, to answer that question. Third, meticulously plan and execute the imaging protocol, considering patient factors, contrast agent properties, and radiation dose. Fourth, form a thorough interpretation of all generated data, integrating findings from different reconstructions and sequences. Finally, communicate the findings clearly and concisely to the referring veterinarian, providing a definitive diagnosis and recommendations for further management. This structured process ensures that advanced imaging is used effectively, ethically, and in accordance with the high standards expected of a DACVR diplomate. Question 7. Upon reviewing an ultrasound image of a canine liver, a radiologist notes a hyperechoic structure with posterior shadowing. Considering the basic principles of ultrasound physics, which of the following explanations most accurately accounts for this observation? Option A. The hyperechoic signal is due to decreased acoustic impedance, and the posterior shadowing is a consequence of increased sound wave refraction. Option B. Hyperechoic signal is a manifestation of acoustic enhancement, and the posterior shadowing is an artifact caused by beam divergence. Option C. The hyperechoic signal is due to increased acoustic impedance of the structure, and the posterior shadowing is a result of significant sound beam attenuation by this material. Option D. The hyperechoic signal is a result of reverberation artifact, and the posterior shadowing is due to increased sound wave scattering. The correct answer is C. The hyperechoic signal is due to increased acoustic impedance of the structure, and the posterior shadowing is a result of significant sound beam attenuation by this material. Explanation. This scenario is professionally challenging because the interpretation of ultrasound images relies heavily on a fundamental understanding of the underlying physics. Misinterpreting these physical principles can lead to incorrect diagnoses, potentially impacting patient care and treatment decisions. The DACVR certification signifies a high level of expertise, and candidates are expected to demonstrate a thorough grasp of these foundational concepts, not just their application. The correct approach represents best professional practice because it directly addresses the core principles of ultrasound physics as they relate to image formation and interpretation. Understanding how sound waves interact with tissues, the factors influencing signal attenuation, and the mechanisms of artifact generation is crucial for accurate diagnostic imaging. This aligns with the ethical obligation to provide competent and evidence-based veterinary care, as expected of a DACVR diplomate. Adherence to these principles ensures that diagnostic interpretations are grounded in scientific understanding, minimizing the risk of misdiagnosis. An incorrect approach that focuses solely on pattern recognition without understanding the physics is professionally unacceptable. This represents a failure to meet the expected standard of knowledge for a DACVR diplomate. It can lead to misinterpretation of artifacts as pathology or failure to recognize subtle abnormalities, directly impacting patient management. Ethically, this approach falls short of the commitment to provide the highest quality diagnostic services. Another incorrect approach that prioritizes speed over accuracy by relying on automated software without critically evaluating the physical basis of the generated images is also professionally deficient. While technology is valuable, a diplomate must be able to critically assess its output and understand its limitations, which are rooted in physics. Failure to do so can result in accepting erroneous interpretations, violating the duty of care. A third incorrect approach that neglects the impact of transducer selection and frequency on image resolution and penetration, without understanding the underlying physics, is similarly flawed. Different tissues and depth require specific ultrasound parameters, and a lack of understanding of the physics governing these choices can lead to suboptimal imaging and misdiagnoses. This demonstrates a lack of comprehensive knowledge expected of a specialist. The professional reasoning process for similar situations involves a cyclical approach. Observe the image, hypothesize potential causes based on clinical information, critically evaluate the image based on fundamental ultrasound physics principles, consider potential artifacts and their physical origins, and integrate this understanding with clinical findings to arrive at a confident diagnosis. If there is uncertainty, revisiting the physics principles or consulting with colleagues is essential. Question 8. The risk matrix shows a potential for misinterpretation of subtle radiographic findings in a young Labrador retriever presenting with hind limb lameness. The radiologist observes a slight irregularity in the cranial aspect of the femoral head. Considering the breed and age, what is the most appropriate comparative radiographic anatomical approach to differentiate between early developmental dysplasia and normal epiphyseal variation? Option A. Focus solely on the presence of osteophytes or joint space narrowing, as these are definitive signs of pathology, and disregard subtle irregularities in the femoral head contour. Option B. Compare the affected femoral head to the contralateral femoral head and assess for symmetry. Evaluate the acetabular coverage and consider the overall joint congruity, while also referencing breed-specific radiographic signs of developmental dysplasia and normal epiphyseal development in young canids. Option C. Assume the finding is a normal epiphyseal variation due to the patient's young age and dismiss the lameness as unrelated to the radiographic observation without further comparative analysis. Option D. Conclude that any irregularity in the femoral head of a young Labrador retriever with lameness is indicative of developmental dysplasia and recommend immediate further investigation for surgical intervention. Correct answer is B. Compare the affected femoral head to the contralateral femoral head and assess for symmetry. Evaluate the acetabular coverage and consider the overall joint congruity, while also referencing breed-specific radiographic signs of developmental dysplasia and normal epiphyseal development in young canids. Explanation. The scenario presents a common challenge in veterinary radiology, differentiating subtle radiographic findings that could represent normal anatomical variation versus early pathological changes. This requires a deep understanding of comparative radiographic anatomy across species and breeds, as well as an appreciation for the limitations of radiographic interpretation. The professional challenge lies in avoiding both overdiagnosis, which can lead to unnecessary anxiety and expense for the owner, and underdiagnosis, which can delay crucial treatment. Adherence to the DACVR emphasis on evidence-based interpretation and responsible practice is paramount. The correct approach represents best professional practice because it prioritizes a systematic, comparative analysis grounded in established veterinary radiological principles. By considering the specific species, breed, age, and clinical history, and by comparing findings to known normal variations and common pathologies, the radiologist can make the most informed diagnostic assessment. This aligns with the ethical obligation to provide accurate and responsible interpretations, minimizing patient harm and owner distress. The DACVR expects diplomates to apply this rigorous analytical process, demonstrating mastery of radiographic interpretation beyond simple pattern recognition. An incorrect approach that relies solely on a single, isolated finding without considering the broader context is professionally unacceptable. This could lead to misinterpretation due to overlooking normal anatomical variants or breed-specific predispositions. Such an approach fails to meet the DACVR standard for comprehensive diagnostic reasoning and could be considered a failure in due diligence, potentially leading to inappropriate clinical decisions. Another incorrect approach that focuses only on the most common pathologies for a given species, without considering less frequent but equally important differentials, is also flawed. This demonstrates a lack of thoroughness and can result in misdiagnoses of rare but serious conditions. Ethically, this represents a failure to provide a complete and accurate interpretation. A third incorrect approach that prioritizes speed over accuracy, making a presumptive diagnosis based on limited information, is a direct contravention of professional standards. This can lead to significant diagnostic errors and negatively impact patient care. The DACVR expects a deliberate and thorough evaluation of all available radiographic information. The professional decision-making process for similar situations involves 1. Thoroughly reviewing all available radiographic images, noting all findings. 2. Critically evaluating each finding in the context of the patient's signalment species, breed, age, sex, and clinical history. 3. Consulting relevant literature and comparative anatomical resources to understand normal variations and common pathologies for the specific patient. 4. Developing a differential diagnosis list based on the findings and context. 5. Formulating a concise and accurate interpretation that addresses the most likely diagnoses and suggests further diagnostic steps if necessary, always acknowledging limitations of the modality. Question 9. Examination of the data shows a focal, hypoechoic, and irregular lesion within the parenchyma of the spleen of a 10-year-old Labrador retriever presenting with lethargy and anorexia. The lesion measures 1.5 cm in diameter and exhibits mild peripheral vascularity on Doppler. Considering the signalment and clinical signs, which of the following interpretive approaches best reflects a comprehensive and diagnostically sound evaluation? Option A. Dismiss the finding as a common artifact or benign cyst, as hypoechoic lesions are frequently encountered in the spleen and rarely significant in older dogs. Option B. Recommend broad-spectrum antibiotic therapy and reevaluation in 2 weeks, assuming the lesion represents an early stage of splenic abscessation due to the hypoechoic nature. Option C. Conclude that the lesion is unequivocally a hemangiosarcoma based on its hypoechoic and irregular appearance, recommending immediate splenectomy. Option D. Report the presence of a focal, hypoechoic, and irregular splenic lesion with peripheral vascularity, recommending further diagnostic imaging such as computed tomography, CT, and fine needle aspirate or biopsy for definitive characterization, while considering differentials such as neoplasia, abscess, or granuloma. The correct answer is C. Conclude that the lesion is unequivocally a hemangiosarcoma based on its hypoechoic and irregular appearance, recommending immediate splenectomy. Explanation: scenario analysis. This scenario presents a common challenge in veterinary radiology, differentiating subtle, potentially pathological ultrasound findings from normal anatomical variations or artifacts. The professional challenge lies in the inherent subjectivity of ultrasound interpretation, the need for comprehensive knowledge of comparative anatomy and physiology across species, and the potential for misinterpretation to lead to inappropriate treatment decisions, increased patient morbidity, or unnecessary diagnostic procedures. The radiologist must integrate real-time imaging data with clinical history and other diagnostic information, while adhering to established diagnostic criteria and reporting standards. Correct approach analysis. The correct approach involves a systematic and thorough evaluation of the ultrasound images, considering the specific anatomical region, the patient's signalment, and the clinical context. This includes recognizing characteristic echogenicity, texture, shape, and acoustic properties of normal structures, as well as identifying deviations from these norms that suggest pathology. The radiologist must also be adept at identifying and distinguishing common ultrasound artifacts from true pathology. This meticulous approach aligns with the core principles of diagnostic imaging and the ethical obligation to provide accurate and reliable interpretations, as expected of a diplomate of the American College of Veterinary Radiology. Adherence to established reporting guidelines and the use of precise, descriptive language are crucial for effective communication with the referring veterinarian and for ensuring appropriate patient management. Incorrect approaches analysis. One incorrect approach is to make a definitive diagnosis based on a single, isolated finding without considering the broader ultrasound image, the clinical presentation, or potential artifacts. This violates the principle of comprehensive interpretation and can lead to misdiagnosis. Ethically, it represents a failure to exercise due diligence and professional judgment. Another incorrect approach is to overinterpret subtle findings as pathological when they represent normal anatomical variants or common artifacts. This can result in unnecessary further investigations, treatments, and increased costs for the owner, potentially causing undue stress and financial burden. This approach demonstrates a lack of experience or insufficient knowledge of normal ultrasound appearance, which is a failure to meet the expected standard of care for a DACVR. A third incorrect approach is to dismiss a potentially significant finding due to a lack of familiarity with less common pathologies or variations. This can lead to delayed diagnosis and treatment of serious conditions, directly impacting patient welfare and potentially violating the veterinarian's duty of care. Professional reasoning. Professionals should approach ultrasound interpretation with a structured methodology. This begins with a thorough review of the signalment and clinical history. Next, a systematic scan of the target organ or region is performed, evaluating all relevant parameters: echogenicity, size, shape, margins, acoustic enhancement/shadowing, vascularity. Each finding should be assessed in the context of normal anatomy and potential artifacts. When encountering abnormal findings, their characteristics should be compared to known pathological descriptions. If uncertainty exists, consultation with colleagues, review of reference materials, or recommendation of further imaging modalities should be considered. Clear and concise reporting, detailing both normal and abnormal findings, and providing a differential diagnosis or definitive diagnosis with appropriate recommendations, is paramount. Question 10. Performance analysis shows that a significant proportion of veterinary radiologists occasionally deviate from standard CT scan protocols for abdominal pathologies. Considering the DACVR emphasis on evidence-based practice and patient welfare, which of the following approaches to protocol selection for a suspected hepatic mass in a canine patient best exemplifies adherence to these principles? Option A. utilizing a highly specialized, multi-phase contrast-enhanced CT protocol designed for complex vascular anomalies, even though the primary clinical concern is a solid hepatic mass, to ensure comprehensive imaging of all possible hepatic pathologies. Option B. Directly applying a pre-programmed, generic abdominal CT protocol from the CT scanner's default settings without specific consideration for the hepatic mass or the patient's clinical presentation. Option C. Selecting a standard abdominal CT protocol that includes arterial, portal venous, and delayed phases, with adjustments to slice thickness and field of view based on the estimated size of the liver and suspected mass, after reviewing the patient's clinical history and laboratory findings. Option D. Implementing a generalized, low-dose abdominal CT protocol for all suspected hepatic lesions, regardless of their suspected nature or the patient's clinical status, to minimize radiation exposure. The correct answer is C. Selecting a standard abdominal CT protocol that includes arterial, portal venous, and delayed phases, with adjustments to slice thickness and field of view based on the estimated size of the liver and suspected mass, after reviewing the patient's clinical history and laboratory findings. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary radiologist to balance diagnostic efficacy with patient safety and resource management, all within the strict confines of established protocols and the need for accurate diagnosis. The radiologist must consider the specific clinical question, the patient's condition, and the potential for radiation exposure and contrast agent-related complications. Adherence to established protocols is paramount, but so is the ability to adapt when clinically indicated, while still justifying any deviations. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based method for protocol selection. It involves a thorough review of the patient's history, clinical signs, and the specific diagnostic question. This allows for the selection of a protocol that is optimized for the suspected pathology, minimizing unnecessary radiation dose and contrast agent administration while maximizing diagnostic yield. This aligns with the ethical obligation to provide competent veterinary care and the regulatory expectation of practicing within established standards of care. The DACVR emphasis on rigorous training and adherence to best practices in diagnostic imaging supports this approach. Incorrect approaches analysis. One incorrect approach involves defaulting to a single, generalized CT protocol for all suspected abdominal pathologies. This fails to account for the specific nuances of different conditions, e.g., inflammatory versus neoplastic processes, vascular versus parenchymal disease. Such a generalized approach can lead to suboptimal image quality, missed subtle findings, or unnecessary radiation exposure and contrast administration, thereby failing to meet the standard of care expected of a DACVR Diplomate. It also disregards the principle of tailoring diagnostic procedures to the individual patient and clinical question. Another incorrect approach is to arbitrarily increase scan parameters, e.g., slice thickness, radiation dose, without a clear diagnostic rationale. This not only increases the risk of radiation-induced injury, but also the likelihood of contrast-related adverse events, without a commensurate increase in diagnostic information. This demonstrates a lack of critical thinking and adherence to the ALARA, as low as reasonably achievable, principle, which is a fundamental ethical and regulatory consideration in veterinary radiology. A third incorrect approach is to solely rely on the referring veterinarian's initial request without further critical evaluation or consultation. While collaboration is essential, the Diplomate has the ultimate responsibility to ensure the chosen protocol is diagnostically appropriate and safe. Failing to critically assess the request and potentially modify the protocol based on their expertise and the available information would be a dereliction of professional duty. Professional reasoning. Professionals should approach protocol selection by first understanding the clinical context and the specific diagnostic question. This involves a thorough review of the patient's signalment, history, and physical examination findings. Next, they should consult established imaging guidelines and literature relevant to the suspected condition. The chosen protocol should then be critically evaluated for its ability to answer the clinical question, its safety profile, radiation dose, contrast agent considerations, and its efficiency. Any deviations from standard protocols must be clearly justified and documented. This systematic process ensures that diagnostic imaging is performed competently, ethically, and in the best interest of the patient. Question 11. Governance review demonstrates a radiologist interpreting thoracic radiographs of a canine patient presenting with a mild, nonspecific cough. The images reveal subtle, ill-defined opacities in the caudal lung lobes that could represent early interstitial pneumonia, a mild aspiration event, or even superimposed pleural or mediastinal structures. The radiologist is confident in their ability to interpret radiographs, but is unsure of the definitive cause of these opacities. What is the most appropriate professional approach to interpreting these findings? Option A. Dismiss the opacities as likely artifacts from patient movement or positioning, and conclude the radiographs are unremarkable for the presenting clinical signs. Option B. Report the findings as equivocal, describing the differential diagnoses including early interstitial pneumonia, aspiration, and superimposed structures, and recommend further investigation such as thoracic ultrasound or a repeat radiograph in a short interval. Option C. State that the findings are too subtle to interpret and recommend the owner pursue advanced imaging modalities without providing any differential diagnosis or assessment of the current radiographs. Option D. Provide a definitive diagnosis of interstitial pneumonia, recommending immediate treatment and further diagnostic imaging. Correct answer is D. Provide a definitive diagnosis of interstitial pneumonia, recommending immediate treatment and further diagnostic imaging. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary radiology, distinguishing between a true pathological finding and a normal anatomical variant or artifact, especially when the radiographic signs are subtle or mimic pathology. The professional challenge lies in the potential for misinterpretation to lead to either unnecessary further diagnostics and treatments, causing financial burden and stress to the owner, and potential iatrogenic harm to the animal, or a misdiagnosis, delaying crucial treatment. The radiologist must exercise meticulous judgment, integrating knowledge of anatomy, physiology, common pathologies, and imaging artifacts. Correct approach analysis. The correct approach involves a systematic and comprehensive interpretation process. This includes carefully evaluating the radiographic quality, identifying all structures, comparing findings to known normal variations and common artifacts, and considering the clinical history. When faced with ambiguity, the best professional practice is to acknowledge the uncertainty and recommend further investigation or consultation. This aligns with the ethical obligation to provide accurate diagnostic information and avoid causing harm. Specifically, within the DACVR framework, this emphasizes the core competency of diagnostic interpretation and the commitment to patient welfare. The radiologist's responsibility is to provide the most accurate assessment possible, and when that assessment is equivocal, to clearly communicate the limitations and suggest appropriate next steps. This upholds the principles of responsible veterinary practice and the integrity of the diagnostic process. Incorrect approach is analysis. One incorrect approach is to definitively diagnose a pathology based on subtle or equivocal findings without considering alternative explanations. This represents a failure in thoroughness and can lead to misdiagnosis, violating the ethical imperative to provide accurate information and potentially causing harm through unnecessary interventions. It demonstrates a lack of critical appraisal of the radiographic evidence and a disregard for the potential for artifacts or normal variations. Another incorrect approach is to dismiss a potentially significant finding as an artifact or normal variation without sufficient justification or consideration of the clinical context. This can lead to a misdiagnosis, delaying essential treatment and negatively impacting patient outcomes. Ethically, this is a failure to exercise due diligence and to act in the best interest of the patient. It suggests a lack of comprehensive knowledge or an insufficient level of scrutiny. A third incorrect approach is to provide a definitive interpretation without acknowledging any degree of uncertainty, even when the radiographic signs are not entirely clear. This misrepresents the diagnostic confidence and can mislead the referring veterinarian and owner. It fails to uphold the principle of transparent communication and can erode trust in the diagnostic process. Professional reasoning. Professionals should approach radiographic interpretation with a structured methodology. This involves 1. Assessing image quality. 2. Systematically reviewing each anatomical region. 3. Comparing findings with established knowledge of normal anatomy and common pathologies. 4. actively considering potential artifacts and normal variations. 5. Integrating the clinical history and other diagnostic data. And 6. Clearly articulating the level of confidence in the interpretation, including any limitations or recommendations for further investigation. When uncertainty exists, it is professionally responsible to communicate this clearly and suggest appropriate next steps to ensure the best possible patient care. Question 12. Analysis of the diverse applications of diagnostic ultrasound in veterinary medicine, considering its utility in abdominal, cardiac, and musculoskeletal imaging across a spectrum of species, leads to the conclusion that a DACVR diplomate must possess a comprehensive understanding of which of the following. Option A. The ability to apply ultrasound principles and adapt imaging protocols for accurate diagnosis in abdominal, cardiac, and musculoskeletal systems across a wide range of veterinary species, recognizing species-specific anatomical and physiological variations. Option B. Expertise in performing advanced cardiac ultrasound techniques exclusively in canines and felines, with limited knowledge of its application in other species or organ systems. Option C. Proficiency in musculoskeletal ultrasound for equine athletes, with no requirement to understand its use in other species or for abdominal and cardiac imaging. Option D. A deep understanding of abdominal ultrasound in large animals only, with minimal emphasis on small animal or musculoskeletal applications. The correct answer is A. The ability to apply ultrasound principles and adapt imaging protocols for accurate diagnosis in abdominal, cardiac, and musculoskeletal systems across a wide range of veterinary species, recognizing species-specific anatomical and physiological variations. Explanation. This scenario presents a professional challenge due to the inherent variability in ultrasound applications across different species and organ systems, requiring a diagnostician to synthesize knowledge and apply it judiciously. The core of the challenge lies in recognizing that, while general principles of ultrasound physics and image acquisition apply, species-specific anatomy, physiology, and common pathological presentations necessitate tailored diagnostic approaches. Careful judgment is required to select the most appropriate ultrasound techniques and interpret findings accurately within the context of the individual patient and its species. The correct approach represents best professional practice by demonstrating a comprehensive understanding of ultrasound's utility across diverse veterinary species and organ systems, aligning with the core competencies expected of a diplomate of the American College of Veterinary Radiology, DACVR. This involves recognizing the broad applicability of ultrasound for abdominal, cardiac, and musculoskeletal evaluations in various species, from common domestic animals to more exotic ones, and understanding how to adapt protocols and interpret findings accordingly. This aligns with the DACVR commitment to advancing veterinary radiology through rigorous training and examination, emphasizing broad diagnostic capabilities. An incorrect approach that focuses solely on a single species or organ system without acknowledging the broader scope of DACVR expertise would be professionally deficient. This would fail to meet the comprehensive diagnostic expectations of the college. Another incorrect approach might overemphasize a specific advanced technique without considering its applicability or necessity in a given species or clinical scenario, potentially leading to inefficient or misleading diagnostic efforts. A third incorrect approach could involve a superficial understanding of species-specific variations, leading to misinterpretation of findings or the omission of critical diagnostic steps. These failures would represent a lack of the depth and breadth of knowledge expected of a DACVR diplomate, potentially impacting patient care and diagnostic accuracy. The professional decision-making process for similar situations should involve a systematic evaluation of the clinical question, the patient's species and signalment, and the available diagnostic modalities. A thorough understanding of the strengths and limitations of ultrasound in different species and for various anatomical regions is crucial. This includes considering the typical anatomical variations, common disease processes, and the technical challenges associated with imaging specific species or organs. The diagnostician must then select the most appropriate ultrasound approach, interpret the findings in light of the clinical context, and integrate this information with other diagnostic data to formulate a comprehensive diagnosis and treatment plan. This iterative process ensures that diagnostic efforts are targeted, efficient, and ultimately beneficial to the patient. Question 13. Compliance review shows a veterinary teaching hospital is considering using a radiopharmaceutical for diagnostic imaging in a canine patient. This specific radiopharmaceutical is approved by the FDA for nuclear medicine imaging in feline patients, but has not undergone specific FDA approval for use in canines. The attending veterinary radiologist is aware of the potential diagnostic utility for the canine patient, but also recognizes the lack of established safety and efficacy data for this species. What is the most appropriate approach to address this situation? Adhering strictly to U.S. regulatory frameworks and professional ethical guidelines for veterinary radiology. Option A. Administer the radiopharmaceutical without further discussion with the owner, assuming that its approval for felines implies general safety and efficacy for other companion animals. Option B. Decline to use the radiopharmaceutical and recommend alternative, less informative diagnostic imaging modalities, even if they are significantly less effective for the intended diagnosis. Option C. Proceed with the imaging using the radiopharmaceutical, documenting the rationale for off-label use, and obtaining comprehensive informed consent from the owner detailing the lack of specific FDA approval for canines and potential risks. Option D. Administer the radiopharmaceutical, and then inform the owner of the off-label use and potential risks after the procedure is completed. The correct answer is C. Proceed with the imaging using the radiopharmaceutical, documenting the rationale for off-label use, and obtaining comprehensive informed consent from the owner detailing the lack of specific FDA approval for canines and potential risks. Explanation. Scenario analysis. This scenario presents a professional challenge related to the application of nuclear medicine imaging in veterinary radiology, specifically concerning the ethical and regulatory implications of using radiopharmaceuticals in a species not explicitly approved by regulatory bodies for that agent. The veterinarian must balance the potential diagnostic benefit for the patient against the lack of established safety and efficacy data, potential for off-label use issues, and the need for informed consent from the owner. This requires careful judgment to ensure patient welfare, adherence to professional standards, and compliance with relevant regulations governing the use of radioactive materials. Correct approach analysis. The correct approach involves a thorough risk-benefit assessment, consultation with experts, and obtaining comprehensive informed consent from the owner. This aligns with the principles of responsible veterinary practice and the ethical guidelines for the use of radiopharmaceuticals. Specifically, it addresses the need to document the rationale for off-label use, acknowledge the limitations of available data, and ensure the owner fully understands the potential risks and benefits. This proactive approach minimizes potential harm to the patient and protects the veterinarian from regulatory scrutiny by demonstrating due diligence and a commitment to patient-centered care within the established framework for veterinary medical practice. Incorrect approaches analysis. One incorrect approach would be to proceed with the imaging without a detailed discussion of the off-label nature of the radiopharmaceutical use, and without obtaining specific informed consent for this deviation from standard practice. This failure constitutes a significant ethical lapse and potential regulatory violation, as it bypasses the owner's right to make informed decisions about their pet's care and may contravene guidelines regarding the use of unapproved agents or indications. Another incorrect approach would be to administer the radiopharmaceutical without consulting with a board-certified veterinary radiologist or nuclear medicine specialist. This demonstrates a lack of professional due diligence and a failure to leverage specialized expertise, which is crucial when dealing with novel or off-label applications of diagnostic agents. This can lead to suboptimal diagnostic outcomes or unforeseen complications, and it neglects the professional responsibility to seek guidance when faced with complex clinical scenarios. A third incorrect approach would be to assume that because the radiopharmaceutical is approved for use in another species, it is automatically safe and effective for the current patient without further investigation or justification. This overlooks the species-specific pharmacokinetics, pharmacodynamics, and potential toxicities of radiopharmaceuticals, and it fails to acknowledge the regulatory requirements for demonstrating safety and efficacy for each intended use. This can lead to patient harm and regulatory noncompliance. Professional reasoning. Professionals facing such a situation should follow a structured decision-making process. First, they must identify the core issue, the use of a radiopharmaceutical in a non-standard application. Second, they should gather all available information, including literature on the radiopharmaceutical's properties, any existing data on its use in similar species, and potential alternatives. Third, they must consult with relevant specialists, such as a board-certified veterinary radiologist or nuclear medicine specialist, to gain expert insight. Fourth, they must conduct a thorough risk-benefit analysis for the specific patient. Fifth, they must engage in transparent and comprehensive communication with the owner, clearly explaining the off-label nature of the proposed procedure, the potential benefits, risks, and uncertainties, and obtain explicit informed consent. Finally, they must document all consultations, assessments, and consent in the patient's medical record. Question 14. Strategic planning requires a veterinarian to consider the ethical implications of image acquisition techniques when faced with a critically ill young canine patient requiring thoracic radiographs. The standard protocol involves a higher radiation dose, but the veterinarian is concerned about the cumulative effects of radiation on a developing animal. What is the most ethically sound and professionally responsible approach to acquiring these diagnostic images? Option A. Proceed with the standard higher-dose radiographic protocol without modification, as diagnostic accuracy is paramount in a critical patient. Option B. Significantly reduce both kilovoltage, kVp, and milliamperage second, m, as to the lowest possible settings to drastically reduce radiation dose, even if it compromises image clarity. Option C. Decline to perform thoracic radiographs due to concerns about radiation exposure to the young patient, opting for a less definitive diagnostic method. Option D. Modify the standard radiographic technique by decreasing the kilovoltage, kVp, and increasing the milliamperage second, m, as to achieve a diagnostic image while minimizing patient dose, and ensure precise collimation to the area of interest. The correct answer is D. Modify the standard radiographic technique by decreasing the kilovoltage, kVp, and increasing the milliamperage second, m, as to achieve a diagnostic image while minimizing patient dose, and ensure precise collimation to the area of interest. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from a conflict between the immediate need for diagnostic information and the ethical imperative to minimize radiation exposure to a vulnerable patient. The veterinarian is faced with a situation where standard imaging protocols might be insufficient due to the patient's condition, but deviating from these protocols carries inherent risks. The ethical dilemma lies in balancing the potential diagnostic benefit against the principle of ALARA, as low as reasonably achievable in radiation exposure, particularly in a young animal where long-term effects are a concern. The pressure to provide a definitive diagnosis for a critically ill patient adds to the complexity. Correct approach analysis. The correct approach prioritizes patient safety and ethical radiation practices while still aiming for diagnostic efficacy. This involves a thorough risk-benefit assessment, consultation with colleagues or specialists if necessary, and the judicious application of advanced imaging techniques or protocol modifications. Specifically, utilizing lower kVp and higher m as to maintain image quality while reducing dose, or employing techniques like collimation and appropriate filtration, directly aligns with the ALARA principle and the ethical guidelines for responsible use of ionizing radiation in veterinary medicine, as implicitly guided by the principles of professional conduct expected of DACVR diplomates. This approach demonstrates a commitment to minimizing unnecessary exposure without compromising the diagnostic yield to an unacceptable degree. Incorrect approaches analysis. One incorrect approach involves proceeding with standard, higher-dose protocols without considering patient-specific factors or dose reduction strategies. This fails to uphold the ALARA principle, potentially exposing the young animal to unnecessary radiation and violating the ethical obligation to protect patient welfare. Demonstrates a lack of critical thinking regarding dose optimization. Another incorrect approach is to forego imaging altogether due to radiation concerns, despite the critical need for diagnosis. This would be a failure of professional responsibility, as it prioritizes radiation avoidance over the patient's immediate health and the veterinarian's duty to diagnose and treat. It neglects the diagnostic imperative and the potential for life-saving intervention. A third incorrect approach is to arbitrarily reduce exposure factors without a clear understanding of their impact on image quality and diagnostic accuracy. While aiming to reduce dose, This could render the images non-diagnostic, leading to further investigations, repeat exposures, or misdiagnosis, ultimately not serving the patient's best interest and potentially increasing overall radiation exposure. This demonstrates a misunderstanding of the interplay between exposure factors and image quality. Professional reasoning. Professionals should approach such dilemmas by first identifying the core conflict: diagnostic necessity versus radiation risk. The decision-making process should involve 1. Thoroughly assessing the patient's condition and the specific diagnostic questions that need answering. 2. Reviewing established imaging protocols and considering their applicability and potential for modification. 3. Actively seeking ways to minimize radiation dose while maintaining diagnostic image quality, such as adjusting exposure factors, optimizing positioning, using appropriate collimation, and considering alternative imaging modalities if applicable. 4. Consulting with peers or specialists when uncertainty exists. 5. Documenting the rationale for the chosen imaging approach and any deviations from standard protocols. This systematic approach ensures that patient welfare and ethical radiation practices are paramount. Question 15. Research into the interpretation of radiographic findings in veterinary patients necessitates a nuanced understanding of species-specific normal anatomy. When evaluating a radiograph of a young canine exhibiting a subtle, radiolucent line within the distal femoral epiphysis, which of the following approaches best reflects the application of comparative anatomical knowledge for accurate diagnostic interpretation? Option A. Dismissing the finding as insignificant without further investigation, based on the general assumption that most radiolucent lines in young animals are benign. Option B. Interpreting the finding based on the radiologist's prior experience with similar-looking lesions in feline patients, assuming a degree of anatomical similarity. Option C. Comparing the finding to established normal radiographic anatomical standards for the canine species, considering age-related developmental variations, and consulting authoritative veterinary radiology texts specific to canine skeletal development. Option D. Relying on a single, outdated textbook that primarily focuses on equine skeletal anatomy for comparative reference. Correct answer is C. Comparing the finding to established normal radiographic anatomical standards for the canine species, considering age-related developmental variations, and consulting authoritative veterinary radiology texts specific to canine skeletal development. Explanation. The scenario presents a common challenge in veterinary radiology, interpreting radiographic findings in the context of normal anatomical variations across different species. This requires a deep understanding of comparative anatomy and the ability to differentiate between normal developmental or breed-specific features and pathological processes. The professional challenge lies in avoiding misdiagnosis, which can lead to inappropriate treatment, unnecessary procedures, and compromised patient welfare. Adherence to the DACVR commitment to excellence in veterinary radiology, which implicitly includes accurate interpretation based on species-specific normal anatomy, is paramount. The correct approach emphasizes a systematic, comparative analysis of radiographic findings against established species-specific normal radiographic anatomy. This aligns with the core principles of diagnostic imaging and the ethical obligation to provide accurate diagnoses. By referencing authoritative texts and databases that detail normal radiographic appearances for various species, the radiologist ensures that interpretations are grounded in scientific evidence and best practices, thereby upholding the standards expected of a diplomate of the American College of Veterinary Radiology. This approach minimizes the risk of misinterpreting normal variations as pathology. An incorrect approach that relies solely on experience without systematic verification risks perpetuating personal biases or overlooking subtle, yet significant, species-specific normal variations. This can lead to overdiagnosis or underdiagnosis. Ethically, this fails to meet the standard of care expected of a board-certified radiologist, potentially leading to patient harm. Another incorrect approach, focusing on a single species' normal anatomy for all interpretations, is fundamentally flawed and demonstrates a lack of understanding of comparative veterinary radiology, a core competency for DACVR certification. This would be a direct failure to apply the necessary specialized knowledge. Relying on anecdotal evidence or non-peer-reviewed sources for anatomical interpretation is also professionally unacceptable, as it lacks the rigor and validation required for diagnostic accuracy and violates the principle of evidence-based practice. The professional decision-making process should involve a thorough review of the radiographic images, followed by a systematic comparison with known normal radiographic anatomy for the specific species and breed. When encountering unusual findings, the radiologist should consult multiple reputable, peer-reviewed resources and, if necessary, seek consultation with colleagues specializing in that particular species or anatomical region. This iterative process of observation, comparison, and verification ensures diagnostic accuracy and promotes optimal patient care. Question 16. The performance metrics show a significant reduction in radiation dose and exposure time with the new digital radiography system compared to the previous film-based system, alongside a reported increase in image acquisition speed. However, anecdotal reports from radiologists indicate a perceived variability in image contrast and the occasional presence of subtle artifacts not previously observed with film. Considering the DACVR emphasis on diagnostic quality and the transition from film to digital, which of the following interpretations of these metrics and reports best aligns with regulatory and ethical best practices for veterinary diagnostic imaging? Option A. The observed improvements in dose reduction and speed are the primary indicators of successful implementation, and the anecdotal reports of image variability and artifacts should be addressed through user retraining rather than system re-evaluation. Option B. The reduction in radiation dose and exposure time are paramount, and any perceived decrease in image quality or presence of artifacts is an acceptable trade-off for enhanced efficiency and patient safety from reduced radiation. Option C. The anecdotal reports of image variability and artifacts suggest that the DR system is inherently inferior to film-based radiography for veterinary diagnostic purposes, and a return to film-based systems should be considered. Option D. A thorough investigation is required to correlate the performance metrics with actual diagnostic efficacy, including a systematic evaluation of image quality parameters, e.g., contrast resolution, signal-to-noise ratio, artifact assessment, and their impact on diagnostic interpretation to ensure the DR system consistently meets or exceeds the diagnostic standards previously achievable with film. The correct answer is A. The observed improvements in dose reduction and speed are the primary indicators of successful implementation, and the anecdotal reports of image variability and artifacts should be addressed through user retraining rather than system re-evaluation. Explanation. Scenario analysis. This scenario presents a common challenge in modern veterinary radiology practices transitioning from older film-based systems to digital radiography, DR. The challenge lies in interpreting performance metrics that may reflect both the inherent capabilities of the technology and the proficiency of the users. It requires a nuanced understanding of how these metrics are influenced by the chosen imaging modality and the regulatory expectations for diagnostic quality and patient safety. The professional challenge is to accurately assess the effectiveness of the DR system and its implementation, ensuring compliance with established standards without being misled by superficial data. Correct approach analysis. The correct approach involves a comprehensive evaluation of the DR system's performance metrics in the context of established diagnostic imaging principles and regulatory guidelines for veterinary radiology. This includes assessing image quality parameters such as spatial resolution, contrast resolution, signal-to-noise ratio, and artifact presence. Crucially, it requires understanding how these metrics compare to benchmarks for digital systems and how they contribute to accurate and timely diagnoses. The regulatory framework for veterinary radiology, as governed by bodies like the American College of Veterinary Radiology, DACVR, through its examination and certification standards, implicitly emphasizes the achievement of diagnostic quality. Therefore, a correct approach focuses on whether the DR system, when operated correctly, consistently produces images that meet or exceed the diagnostic requirements for various veterinary species and anatomical regions, thereby fulfilling the implicit mandate for high-quality diagnostic imaging. This aligns with the ethical obligation to provide the best possible diagnostic information for patient care. Incorrect approach is analysis. An incorrect approach would be to solely focus on metrics that are easily quantifiable without considering their diagnostic relevance, or to assume that any improvement in a metric automatically signifies superior diagnostic capability. For instance, simply noting a reduction in exposure time without assessing if this compromises image quality or increases the risk of motion artifacts would be a failure. Another incorrect approach would be to directly compare raw performance metrics from a film-based system to a DR system without accounting for the fundamental differences in how each modality generates and displays images. Film-based systems have inherent limitations in dynamic range and post-processing capabilities that DR systems overcome. Therefore, a direct, unadjusted comparison of certain metrics might be misleading. Furthermore, an approach that prioritizes cost savings or workflow speed over diagnostic image quality without a thorough evaluation of the diagnostic impact would be a regulatory and ethical failure. The DACVR emphasis on diagnostic competence implies that technology adoption must ultimately serve the goal of accurate diagnosis, and any approach that compromises this is unacceptable. Professional reasoning. Professionals should approach the evaluation of new imaging technology by first understanding the fundamental principles of image formation for both the old and new modalities. They must then consult relevant guidelines and standards from professional organizations like the DACVR to establish benchmarks for diagnostic quality. The evaluation should be holistic, considering not just raw data, but also the clinical impact of the imaging system. This involves a systematic assessment of image quality parameters, user training, and the system's ability to consistently produce diagnostically adequate images across a range of clinical scenarios. When interpreting performance metrics, professionals must ask, does this metric, in the context of this technology, translate to improved diagnostic accuracy and patient care, while adhering to established professional standards? This critical questioning ensures that technological advancements are implemented responsibly and ethically. Question 17. Market research demonstrates that veterinary practices are increasingly investing in advanced imaging equipment. In a scenario where a radiologist is tasked with acquiring thoracic radiographs of a large, obese canine patient, and initial settings result in an image with insufficient contrast and excessive scatter radiation. Which of the following approaches best reflects a risk assessment strategy focused on optimizing image quality and patient safety within the regulatory framework implied by DACVR standards? Option A. Reduce KVP to enhance contrast, even if it means a longer exposure time and potential for motion blur, as contrast is the primary determinant of diagnostic quality. Option B. Rely on post-processing software to correct the image contrast and reduce scatter, without altering the initial radiographic technique factors. Option C. Increase KVP to improve penetration and reduce scatter, while simultaneously decreasing M as to compensate for the increased exposure and maintain overall density, and adjust the source-to-image distance if necessary to further manage scatter. Option D. Immediately repeat the exposure with significantly higher M as to ensure adequate density, accepting the potential for increased scatter and longer exposure time. Correct answer is C. Increase KVP to improve penetration and reduce scatter, while simultaneously decreasing M as to compensate for the increased exposure and maintain overall density, and adjust the source-to-image distance if necessary to further manage scatter. Explanation. The scenario presents a common challenge in veterinary radiology, balancing the need for diagnostic image quality with the practicalities of patient handling and radiation safety. The veterinarian must assess the impact of technical factors on image quality and patient outcomes, considering the ethical and regulatory obligations to provide competent care and minimize radiation exposure. This requires a deep understanding of the principles of radiography and their application in a clinical setting, going beyond simple memorization of parameters. The correct approach prioritizes the diagnostic efficacy of the radiograph, while adhering to established principles of radiation safety and quality assurance, as implicitly guided by the standards expected for DACVR certification. This involves understanding how KVP, MS, and distance interact to produce an image, and how deviations from optimal settings can compromise diagnostic information or increase patient dose unnecessarily. Best professional practice dictates that the radiologist's primary responsibility is to obtain a diagnostic image that allows for accurate interpretation, and this is achieved by judiciously selecting and adjusting technical factors. This aligns with the overarching ethical duty to provide the highest standard of care. An incorrect approach that focuses solely on minimizing radiation dose without regard for diagnostic quality fails to meet the fundamental purpose of radiography, which is to obtain interpretable images. This could lead to repeat exposures, increasing overall radiation burden, or to misdiagnoses, which is a failure of professional duty. Another incorrect approach that prioritizes speed or convenience over technical accuracy can result in suboptimal images that are difficult to interpret, potentially leading to misdiagnosis or delayed treatment. This demonstrates a lack of commitment to the principles of quality imaging and patient care. A third incorrect approach that relies on rote memorization of settings without understanding the underlying principles is also professionally deficient. Radiographic needs vary significantly between patients and imaging situations, requiring adaptive technical adjustments based on a thorough understanding of physics and anatomy, not just preset values. The professional decision-making process for similar situations should involve a systematic risk assessment. First, identify the diagnostic question. Second, consider the patient's physical characteristics and any limitations. Third, select initial technical parameters based on established guidelines and experience, understanding the role of KVP penetration, M as quantity of radiation, and distance inverse square law. Fourth, evaluate the resulting image for diagnostic adequacy, considering factors like contrast, density, sharpness, and absence of artifacts. Fifth, if the image is suboptimal, make informed adjustments to KVP, M as, or distance, understanding the predictable impact of each change on image quality and radiation dose. This iterative process ensures that diagnostic goals are met efficiently and safely. Question 18. Which approach would be most appropriate for a veterinary patient with clinical signs suggestive of intracranial neoplasia, where the primary diagnostic goal is to identify and characterize potential neoplastic lesions, including those that may be small, infiltrative, or multifocal? Option A. Prioritize diffusion-weighted imaging, DWI, due to its sensitivity to changes in water diffusion characteristic of high cellularity, aiding in the detection and characterization of neoplastic tissue. Option B. Employ a combination of all advanced MRI techniques, including DWI and fMRI, without specific consideration for their individual diagnostic contributions to the primary question. Option C. Primarily utilize functional MRI, fMRI, to map areas of altered brain activity, which may indirectly indicate neoplastic involvement. Option D. Rely exclusively on conventional MRI sequences, T1-weighted, T2-weighted, FLAIR, contrast-enhanced T1-weighted, as they provide comprehensive anatomical detail. The correct answer is A. Prioritize diffusion-weighted imaging, DWI, due to its sensitivity to changes in water diffusion characteristic of high cellularity, aiding in the detection and characterization of neoplastic tissue. Explanation. Scenario analysis. This scenario presents a common challenge in advanced veterinary diagnostic imaging, selecting the most appropriate advanced MRI technique for a specific clinical question, balancing diagnostic yield with resource utilization and patient safety. The veterinarian must consider the limitations and strengths of each technique, the potential impact on patient management, and the established standards of practice within the DACVR framework. The challenge lies in moving beyond basic anatomical imaging to interpret functional and microstructural information, requiring a nuanced understanding of the underlying physics and biological applications. Correct approach analysis. The correct approach involves a systematic evaluation of the clinical question and the potential diagnostic information offered by each advanced MRI technique. For suspected intracranial neoplasia with potential for leptomeningeal spread or multifocal involvement, diffusion-weighted imaging, DWI, is paramount. DWI is highly sensitive to changes in water molecule diffusion, which are significantly restricted in areas of high cellularity, such as many types of tumors. This restriction can help differentiate neoplastic tissue from edema or necrosis, identify small or infiltrative lesions not readily apparent on conventional sequences, and assess tumor aggressiveness. Functional MRI, fMRI. While valuable for mapping brain activity and understanding functional localization, is generally not the primary modality for initial lesion detection or characterization of suspected neoplasia in veterinary patients due to its complexity, motion sensitivity, and the current limitations in standardized veterinary fMRI protocols for routine clinical application. Conventional MRI sequences, T1-weighted, T2-weighted, flare, contrast-enhanced T1-weighted, are foundational but may not provide the same level of detail regarding cellularity and diffusion characteristics as DWI. Therefore, prioritizing DWI for its direct relevance to detecting and characterizing neoplastic lesions, especially those with potential for subtle or widespread involvement, represents best professional practice aligned with the diagnostic goals of advanced imaging. Incorrect approaches analysis, focusing solely on functional MRI without a clear indication for mapping brain activity or functional deficits would be a regulatory and ethical failure. fMRI is a specialized technique with specific applications, and its indiscriminate use for lesion detection is inefficient and potentially misleading. It does not directly address the primary diagnostic question of identifying and characterizing neoplastic tissue in the same way DWI does. Relying exclusively on conventional MRI sequences, while a necessary component of a comprehensive MRI examination, would be an incomplete approach if the clinical suspicion warrants the superior sensitivity of DWI for detecting subtle neoplastic changes or assessing cellularity. This would represent a failure to utilize available advanced techniques to their full diagnostic potential, potentially leading to delayed or misdiagnoses, which contravenes the professional obligation to provide the highest standard of care. Professional reasoning. Professionals should approach such scenarios by first clearly defining the clinical question. This involves understanding the differential diagnoses and what specific information is needed to confirm or exclude them. Next, they should consider the capabilities of available advanced imaging techniques, evaluating their sensitivity, specificity, and relevance to the clinical question. The decision-making process should then weigh the diagnostic yield against practical considerations such as patient tolerance, scan time, and the availability of expertise. In this case, high cellularity and potential for restricted diffusion in neoplastic lesions make DWI the most direct and informative technique for initial assessment, while fMRI serves a different, more specialized purpose. This systematic approach ensures that the chosen technique is not only technically feasible, but also diagnostically appropriate and ethically sound, maximizing the benefit to the patient. Question 19. The review process indicates that a 10-year-old Labrador Retriever presents for thoracic radiographs due to suspected pneumonia. The dog is fractious and exhibits significant pain when manipulated. The veterinarian requests lateral and ventrodorsal (VD) projections. Which of the following strategies best balances diagnostic imaging requirements with patient welfare and safety in this challenging scenario? Option A. Administer appropriate sedation or anesthesia to allow for safe and accurate positioning, utilizing supportive devices as needed to maintain the desired posture for both lateral and VD thoracic projections. Option B. Attempt to manually restrain the dog in the required positions for both projections, accepting minor movement artifact if the dog resists, to avoid the risks associated with sedation. Option C. Proceed with the VD projection by placing the dog in dorsal recumbency and manually holding its limbs, without any attempt at pain management or further stabilization, to expedite the imaging process. Option D. Perform only the lateral projection, as it is less challenging to position a fractious and painful dog, and accept the diagnostic limitations. The correct answer is A. Administer appropriate sedation or anesthesia to allow for safe and accurate positioning, utilizing supportive devices as needed to maintain the desired posture for both lateral and VD thoracic projections. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary radiology, achieving diagnostic quality images in a patient with limited cooperation and potential pain, while adhering to established positioning protocols. The challenge lies in balancing the need for precise patient positioning to minimize artifact and maximize diagnostic yield with the patient's welfare and safety. Failure to achieve adequate positioning can lead to misdiagnosis, unnecessary repeat exposures, increasing radiation dose, and potential patient distress. Correct approach analysis. The correct approach prioritizes patient comfort and safety, while employing techniques that compensate for the patient's limitations to achieve the desired radiographic projection. For potentially painful or uncooperative patient, using appropriate sedation or anesthesia is paramount. This allows for safe and accurate positioning, minimizing movement artifact and ensuring anatomical structures are visualized as intended by the specific projection. The use of sandbags or other supportive devices is crucial for maintaining the patient in the correct position without causing discomfort or further injury. This aligns with the ethical imperative to provide the highest standard of care and the regulatory expectation of minimizing patient harm and maximizing diagnostic accuracy. Incorrect approaches analysis. One incorrect approach involves attempting to force the patient into the correct position without adequate sedation or anesthesia. This is ethically unacceptable as it prioritizes the radiographic goal over patient welfare, potentially causing significant pain and distress. It also increases the likelihood of movement artifact, rendering the image diagnostically suboptimal, which is a failure to meet professional standards of care. Another incorrect approach is to accept a poorly positioned image due to the patient's lack of cooperation, without attempting further mitigation. This fails to meet the diagnostic requirements of the projection and can lead to misinterpretation or mispathology. From a regulatory standpoint, it represents a failure to provide adequate diagnostic imaging services. A third incorrect approach might involve using excessive collimation that excludes critical anatomical structures, simply to avoid dealing with patient movement. While collimation is important for dose reduction, it must not compromise the diagnostic quality of the image by excluding essential areas of interest. This is a failure to adhere to established radiographic protocols and diagnostic principles. Professional reasoning. Professionals faced with such a situation should first assess the patient's condition and temperament to determine the safest and most effective approach. This involves considering the need for sedation or anesthesia, the availability of supportive positioning aids, and the specific radiographic projection required. A systematic approach, prioritizing patient welfare and diagnostic accuracy, is essential. If initial attempts at positioning are unsuccessful, reevaluation of the patient's comfort and the chosen technique is necessary. Collaboration with the referring veterinarian regarding patient management is also a key component of responsible practice. Question 20. The analysis reveals that a board-certified veterinary radiologist is tasked with imaging a canine patient suspected of having a gastrointestinal obstruction. The radiologist must select an appropriate contrast medium for radiographic evaluation. Considering the diagnostic goals and patient safety, which of the following approaches represents the most professionally sound and ethically compliant method for selecting the contrast agent? Option A. Opting for a non-ionic low-osmolar iodinated contrast medium typically used for intravenous injections, administering it orally to the patient, as it is readily available in the practice. Option B. Choosing a barium sulfate suspension, ensuring it is specifically formulated for veterinary use and has a well-established safety profile for oral administration in cases of suspected gastrointestinal obstruction. After reviewing the patient's renal function and hydration status. Option C. Selecting a water-soluble iodinated contrast agent that is approved for oral administration in humans and has been used off-label in veterinary medicine for similar indications, prioritizing its availability and lower cost compared to other options. Option D. Utilizing a gas-forming contrast agent, such as carbon dioxide, administered orally, as it is generally considered safe and can provide good mucosal detail without the risk of systemic absorption. The correct answer is C. Selecting a water-soluble iodinated contrast agent that is approved for oral administration in humans and has been used off-label in veterinary medicine for similar indications, prioritizing its availability and lower cost compared to other options. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary radiology where a veterinarian must select the most appropriate contrast medium for a specific diagnostic imaging procedure. The choice is critical as it directly impacts diagnostic accuracy, patient safety, and adherence to regulatory guidelines. The veterinarian must balance the diagnostic yield of the contrast agent against potential adverse effects and the specific requirements of the imaging modality and the anatomical region being examined. This requires a thorough understanding of the pharmacological properties, potential contraindications, and approved uses of various contrast agents. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's clinical presentation, the suspected pathology, the intended imaging modality e.g., radiography, fluoroscopy, CT, and the anatomical location. This evaluation should lead to the selection of a contrast medium that is approved for veterinary use, has a favorable safety profile for the intended route of administration and patient population, and will provide optimal visualization of the target structures without causing undue risk. This aligns with the principles of responsible veterinary practice, emphasizing patient welfare and evidence-based decision-making, which are implicitly supported by the regulatory framework governing veterinary practice and drug use in the United States. The American College of Veterinary Radiology, ACVR, Diplomate is expected to possess this advanced knowledge and apply it judiciously. Incorrect approaches analysis. An approach that prioritizes cost-effectiveness over diagnostic efficacy and patient safety is a significant regulatory and ethical failure. While cost is a practical consideration, it should never supersede the primary duty to provide the best possible diagnostic care and minimize harm to the animal. This could lead to the use of an inappropriate or less effective contrast agent, resulting in a misdiagnosis or the need for repeat procedures, ultimately increasing costs and patient stress. This violates the core tenets of veterinary medical practice. Choosing a contrast medium based solely on personal familiarity or anecdotal experience without considering current literature, established guidelines, or the specific patient's condition is also a failure. Veterinary medicine is a science-driven profession, and decisions must be informed by evidence. Relying on outdated or unverified information can lead to suboptimal diagnostic outcomes and potential patient harm, contravening the expectation of up-to-date knowledge for a diplomate. Selecting a contrast medium without consulting the manufacturer's instructions for use, contraindications, or potential adverse effects represents a failure to adhere to product labeling and safe handling practices. This can lead to administration errors, unexpected reaction, and compromised diagnostic quality, all of which are unacceptable from a patient's safety and regulatory standpoint. Professional reasoning. The professional decision-making process for selecting contrast media should begin with a comprehensive understanding of the diagnostic question. This involves reviewing the patient's history, physical examination findings, and any prior diagnostic tests. Next, the veterinarian must consider the imaging modality to be used and the specific anatomical structures to be evaluated. This leads to identifying potential contrast media that are suitable for the intended purpose. A critical step is then to assess the patient's overall health status, including renal and hepatic function, hydration status, and any known allergies or sensitivities, to identify contraindications. Finally, the veterinarian should consult relevant literature, professional guidelines, and manufacturer information to confirm the safety and efficacy of the chosen contrast medium for that specific patient and procedure, ensuring compliance with all applicable regulations and ethical standards.